Hello students, welcome to my channel and please take a moment to subscribe to my channel if you want to gain full concept of any topic you want. So students, welcome to the biology class, and in this class we learn about the topic the lung cancer. So now we learn about the cancer of the lung. This cancer is a malignant, metastatic, or that can be proliferated tumor which may develop due to uncontrolled division of the cell. First of all, we learn what is malignant tumor word meaning. So malignant means that anything that is just cancerous to our body and can produce cancer cells in our body, and tumor is a group of cells. As we know that in our body every day the cell divides and the cell die. The cell that die are replaced by the new cells that are formed by the division of cell. But as we know that our body need a maximum amount of cells, so when the cell divide more than it is needed, so that group of cells become tumor, and tumor may be cancerous and maybe not, but we have to check the doctor. So it become confirmed that this tumor is cancerous or not. So malignant tumor means that group of cells that are cancerous to the body which are formed due to uncontrolled division. Uncontrolled division means that division of the cells that are not controlled by the body, and the cell is divided again and again and again, and a group of cells are formed that become cancerous to the body is called the uncontrolled division of cell. And we learned that there is metastatic and proliferated tumor. Metastatic tumor means that the tumor that remain in one part of the organ and that does not spread more. But proliferated tumor means that the tumor that spreads to other organ of the body and can affect many other organ of the body, and in this way the tumor or the cancer spread to other organ of the body as well. So the cancer is a malignant tumor means that the cancer is a harmful group of cell that is formed due to uncontrolled division of the cell. Causes of the lung cancer. As we know that smoking in the form of cigarette, in the form of cigar, in the form of shisha, or any other form that is inhaled in the body and that is harmful for the body, and we smoke it, and we know that the smoking is the major cause of lung cancer, and about 95% people who smoke usually get adopted to the lung cancer. So smoking is the main cause of the lung cancer. Why? Because tobacco smoke contain many carcinogens. Carcinogens are the substances which are capable to produce cancer in any living tissue of a human body. So the smoke of the cigarettes, of cigar, or any other substance like this contain the carcinogens that we inhale and go into the lungs and destroy the lung tissues. So the main cause of lung cancer is smoking. The other major causes of lung cancers are asbestos. Asbestos are minerals which are used in industries, and when the smoke come out of it from the industries, the smoke get involved into the air, and when we inhale that polluted air, the asbestos minerals particle goes into the body and can be harmful to the body, as well as arsenic are used to clean the water, so they are also found in contaminated water which are used for cooking, drinking, and when there is large amount of arsenic in the water which we drink, which is used to make our food, the arsenic will go into the body and can damage our lung, which is also the reason of the lung cancer. The radiation such as X-rays and gamma rays. X-rays and gamma rays can cause lung cancer in a way that the X-ray and gamma rays has high penetrating power. High penetrating power means that they can pass through our body more easily, and these radiations are very harmful, so they can easily pass it into our skin and can damage various cells of our body, as well as they can also pass it through different organs of the body and can damage them. So they are also the causes of the lung cancer. As well as we know that the sun contains many harmful radiations that can damage our skin or a different organ of the body or our cells of the body, so it is also the cause of the lung cancer. The smoke of cars. The smoke of car is, we know that the car contain petrol, and when the petrol burn out, it produces the smoke that go right away into our air, and when we inhale that air, it go right away into our lungs and can damage different cells of our lungs. So the smoke of the cars that are coming from it can also cause lung cancer, and all of this, the arsenic, asbestos, the x-ray, gamma rays, sun, and the smoke of car, all of these contain carcinogens, mean that all of these contain the substance that can cause cancer in our living cells or tissues. Now we learn about the symptoms of the lung cancer. The first thing or the first event that happen is the thickening and the overgrowth of the cells lining the bronchi. The bronchi is the main passageway or a main tube that carries the air into the lungs. So if that tube or a passageway is damaged, so it will also disturb the process of breathing of the person, or the person become very hard to breathe, or sometime at a severe condition become unable to breathe. There is loss of cilia, so that it is impossible to prevent dust and the dirt from entering into the lungs or setting into the lungs. So the bronchi is a tube, and inside the wall of bronchi there are cilia. Cilia are hair-like structure that are present in the wall of bronchi, and that functions in carrying away the dust particle from the air entering into the lungs. So when the air passes from the bronchi to enter into the lungs, the cilia of the bronchi take away all the dust particle and attach all the dust particle from the air, so that the purified air or clean air enter into the lungs, and that will not damage the cells of the lungs. So if the bronchi is damaged, as well as the cilia will also become damaged, so all kind of the dust particle of the air will enter into the lungs and will damage the lungs and can cause the lung cancer. When the condition become very severe and the tumor grow mean that group of cell divide again and again and again, and large amount of group of cell is produced inside the body that is not needed to the body and is unwanted to the body, and as well they become cancerous to the body. So these unwanted cells that are tumor are grow in a large amount of group that it become cancerous to the body, and when they grow again and again, the bronchi will block, because the more cells divide again and again, so that the whole bronchi inside the wall of the inside wall of the bronchi, it become filled with all the divided cells that are formed inside it. As so in this way the air will become unable to pass through the cells, so it will block the breathing system or air supply to the lungs, so it become unable for the person to breathe in a severe lung cancer. Treatment of the lung cancer. The only treatment that gives cure is to remove the lobe or the lung completely before the secondary growth have time to occur. As we know that the lungs have lobe, the left lung has 3 lobe while the right lung has 2 lobe, because it shares space with heart. That's why there are 5 lungs of the lobe, and if the tumor occur in any part of the lobe and remain in that lobe, so we have to cut that part of the lobe of the lung surgically. So it is used to remove the lobe of the lung if the tumor is remain in that lobe. But if the tumor spread out from that lobe and spread through whole that lung, so we have to remove fully the whole lung until the secondary growth have time to start. Secondary growth mean that more severe growth of lung cancer or more severe division of the cells that result in more tumor in the lungs, which result in more severe lung cancer. So the whole lung that is affected is removed out from the body, so that the tumor may not grow more and the severe condition will not happen. So whole the lung that is affected is removed out of the body surgically, and this treatment is called pneumonectomy. This is a treatment in which the lung or the one lobe of the lung is removed surgically so that the tumor may not spread more. The treatment also include chemotherapy and radiotherapy. Chemotherapy is given in a condition when the lung cancer is not too severe and we get to know that the person has lung cancer, so the doctor will prescribe him chemotherapy treatment. In this treatment, the medicines or the drugs are given to that person so that the drugs and the medicines will slow down the division of the cell and uncontrolled division of the cell that result in the group of cells which result in tumor. So chemotherapy is a medicine or a drug that is given to the patient so that it take inside its body and do not have to go to surgical treatments, so that the medicine can suppress or slow down the uncontrolled division of the cell so the tumor may stop through the medicine. And radiotherapy means that if the condition become more severe, that chemotherapy will not be effective to that person. So radiotherapy is a treatment in which an instrument is used which is used to produce radiations, and that radiations are pointed to the affected lobe or the lung of that person so that the tumor are destroyed by the radiations that are very strong radiations, and these strong radiations will kill the tumor in the lung or the lobe of the lung so that the lung cancer will not spread more and it is suppressed at that time. So I hope you like the video, and if you like the video, please like and share this video. And if you have any queries still related to this topic, you can ask me in the comment section below.